All right, so we are going to talk today about a skin cancer reconstruction. The reason I wanted to highlight this case is because I do things just a little bit differently, and I think it works really well in my practice. What we're looking at here is it's a pretty close to total tip defect after a Mohs surgery. And so this patient came in, he had a skin cancer, the Mohs surgeon took off the area, and now he's left with a wound. And the classic traditional way to treat this would be with a forehead flap or a cheek flap or some kind of skin to bring in because it's almost the entire nasal tip subunit missing. But I have found that this Pedicled Nasalis muscle flap works excellent for these. And so you'll see here as we go through some of the photos how we draw it out. We pedicle it on the side of the nasalis muscle, which spans across the nose to give the flap some blood supply based on the angular artery. And then we design the flap like a big V. Here you can see we dissect almost the entire nose, release the flap all the way down to the pedicle, down to the muscle. Use it where we can just mobilize the flap on the muscle, and that gives us this full mobility. And I think that's the big difference. If you were going to do a traditional like VY flap or something, you wouldn't get this much mobility, and that's what you need if you're going to close a really big defect down at the bottom of the nose. Because of that, you can see here how we can move the skin from the top of the nose as the flap all the way down. You can see where it's attached to the muscle. You can see how much play we actually have in that, but we still have a really good blood supply. Comes all the way down, closes up the area on the nasal tip, lines up very nicely, and then because you've basically released all the ligamentous attachments of the envelope, soft tissue envelope covering the skin, then you have lots of room to close the rest of the nose behind it. As we kind of progress along, you can see that he healed up really, really well. This is him just 4 months afterwards. Scars are very difficult to perceive. Everything's done in kind of this deep, like what we call like layer 4 plane right over top of the bone underneath the muscle, and the vascularity is maintained. And this allows for 1 stage for this patient. So that was really important for him. We do this on 1 stage under local anesthesia, get him healed up really quickly afterwards. No need for skin grafts or anything, bringing in skin from other locations, other donor sites, and multiple surgeries. And so that's what I think is the big difference maker for this flap and why it's a big workhorse for my practice.